Welcome to our Ardenwood Presents webinar on long-term care for Christian Scientists. And thank you for joining us today. I'm John Mitchell and I serve as Executive Director and CEO of Ardenwood here in San Francisco. You know, for generations, Ardenwood has been a haven for Christian Scientists and their families who count on a supportive spiritual atmosphere. It's also a Christian Science Nurses Training Center, which prepares Christian Scientists to serve the cause through this healing and caring ministry. And it's a beautiful residence for Christian Scientists where they will find room to bloom among fellow residents and staff committed to ageless living. Ardenwood exists because you value having a place to go for healing through the practice and application of Christian Science. Plus, you're eager to be inspired and informed on timely topics related to living the life of a practicing Christian Scientist, like topics covered in today's special event. Ardenwood is a 501c3 charitable nonprofit organization. This means it requires income from our patients, residents, and guests, as well as donations from you to meet our operating expenses. You are invaluable to Ardenwood. Your support enables us to offer uninterrupted services, something we've been doing since 1930. In return, we want to provide you with the best possible care and special events like this one. You bring out the best in us, and we thank you. By the way, our next event will be our 2021 annual meeting, which will be presented online again this year on Sunday, May 2nd at 2 p.m. Pacific. Madeline Maupin will be our inspirational speaker, and the title of her talk is The Bible's Golden Thread of Healing, God's Presence. I just love that. Please keep your eye out for an invitation via email and regular mail. Now, before we begin, I'd like to share a few thoughts with you about today's topic, long-term care for Christian Scientists. That sounds like an oxymoron, doesn't it? Like jumbo shrimp or deafening silence. But we know that there is no such thing as inconclusiveness to the dedicated practice of Christian Science healing. Fidelity to divine principle always brings proofs of truth's triumph over erroneous beliefs. Long-term care suggests the exact opposite. So why are we talking about it? And why are we grateful that so many of you are here today? Because Christian Scientists are wiser than serpents. They are matter-of-factly prepared for moments of inspiring discontent, as the marginal heading in this week's Bible lesson, citation 16 from Science and Health, so aptly describes a challenging time. Christian Scientists are wise. They make responsible, informed personal decisions. Just as important, they don't want to be a burden to their families, not physically, not emotionally, and not financially. So what is long-term care? Well, in spiritual terms, we might describe it as the proposition that we are forever in God's care. It's also a long-term commitment to behold the perfect man for ourselves and for our loved ones, for everyone. In the world's terms, long-term care is custodial care. It assists you with your daily life when you are unable to fully care for yourself. In this sense, Ardenwood is not a long-term care facility. It is not a nursing home. In today's world, we might say there's no parking here. People who come to Ardenwood come for healing. They expect to be healed, as healing is our primary focus. Financing care through Medicare and supplemental insurance helps to cover these shorter-term needs while the patient is actively, metaphysically addressing the specific claims about their well-being. We've all experienced unexpected circumstances in life, ones that encourage us to be better prepared and force us to grow. Long-term care insurance is one way to ensure that your care needs and wishes are met without burdening your family or loved ones. As we've shared in previous webinars, one of the most important first steps in their planning is for everyone to complete an Advanced Healthcare Directive, or an AHCD, and let your family or close friends know where it is. You can find an example of an AHCD form on our website, ardenwood.org. Click on About at the top of the homepage, and then on Healthcare. Scroll to the bottom of the page to find the link to the AHCD. So we hope that today's webinar will answer many of the questions you may have and perhaps prompt more. So there's no one size fits all here. Since more than 580 people registered for this webinar, we have added a Q&A session for next Thursday, March 25th, at the same time, 4 p.m. Pacific. Please note that you'll need to register again if you want to attend next week's Q&A session. And finally, the content shared today is only informational, is not intended to be legal advice. A replay of this presentation will be available on our website tomorrow afternoon. And now, let me introduce today's presenters, Jim Maher and Lesleah Frisco. I understand that many of you have talked with Jim and Lesleah since our last webinar in January. That's great. And please feel free to be in touch with them or Roger Speer with any additional questions. I also want to mention another valuable resource. It's the Christian Science Provider Network. The CS Provider Network is an organization that also provides help to Christian Scientists dealing with questions related to Medicare, Medicare Advantage plans, supplemental policies, and insurance. Everyone's contact information will be available and appear on the screen at the very end of this webinar. So, Jim Maher is a certified senior advisor and a broker consultant specializing in Medicare. And he's been helping individuals and companies navigate Medicare since 1989. He is a frequent guest speaker at law firms, CPAs, medical groups, school districts, Rotary clubs, and both small and large companies. Jim is also a certified long-term care insurance strategist. He specializes in helping human resource professionals with their Medicare questions regarding current employees and how Medicare integrates with retirees and COBRA. Jim lives in Lincoln, California, just north of Sacramento, with Teddy, his wife of 34 years, along with their spoiled rat terriers. I just love that, Jim. Lesleah Frisco is Ardenwood's Director of Christian Science Nursing Services. Lesleah oversees everything related to Christian Science nursing here. And currently, she also heads up our Christian Science Nurses Training Program. Lesleah graduated from the Mother Church's training program and has been journalisted since 1981. One of Leslie's responsibilities is to work with Medicare and insurance to ensure proper coverage for our patients who choose to use their Medicare benefit. She is joined in this effort by another Ardenwood colleague, Roger Speer, who processes our Medicare and supplemental insurance paperwork. Rogers will join Jim and Lesleah during the Q&A period. Ardenwood is one of 10 Medicare Part A Christian Science nursing facilities in the United States. And because our audience is nationwide for this webinar, we will provide a list of the other 9 facilities in an email following this presentation. And finally, before I turn the program over to Jim and Lesleah, let me explain how you can ask questions. If you look at the bottom of your Zoom screen, you'll see an icon that says Q&A. Click on it, and a screen will appear where you can type in a question. Press Submit, and it will arrive here. We will collect them and save them for the end of the presentation. Please join me now in warmly welcoming Jim and Lesleah.
Got it. Well, thank you, John. I appreciate that. It was a nice introduction, and we've got Lesleah. I think Leslie's going to say a few things.
Great. Good evening. Good afternoon. I realize it may sound like a contradiction, Christian Science and long-term care. At Ardenwood, we always maintain an expectancy of healing. Although care needs may carry on for a while, we have no doubt that spiritual growth and regeneration are always taking place. Christian Science healing requires active engagement on the part of the patient, the practitioner, and the Christian Science nurse. Come to Ardenwood for healing as a place to live and grow spiritually, not as a place to die. It may surprise you to know that Ardenwood is not a nursing home. We are a refuge for healing, where dedicated students of Christian Science can receive care that's consistent with the theology of Christian Science. Christian Science nursing does not include any kind of medical care, but it provides practical and skillful care to individuals who are fully relying on God for healing. As a longtime Christian Science nurse, I've had the privilege of witnessing many healings, both in Christian Science care facilities and at home. Some healings happen very quickly, and others seem to take longer. As students of Christian Science, we've all seen proofs of God's care and experienced numerous healings of physical challenges as well. And yet none of us expects that we will ever need care. However, if a situation should arise, we can be prepared, both practically and financially. And that's what long-term care insurance is all about, being prepared. It can also ensure your choice of care. Today, Jim Maher and I will explain several long-term care insurance options available to Christian Scientists, and I will show how you can afford to be in a Christian Science facility like Ardenwood. I will share some thoughts from a Christian Science nursing perspective as well. Ultimately, whether you purchase insurance or not is completely your decision. We're going to share some information that may help you decide what's best for you in your current circumstances. All right, take it away, Jim.
All right, thank you, Leslie. Hey, good evening, everyone. My name is Jim Maher, and I've talked to many of you already regarding Medicare, so now we're going to explore some more long-term care options. I always like to think of retirement as you're kind of sailing off into retirement, and you really want a smooth ride, and that's what we're hoping to present today, a way to make it smooth for everyone. So a little about myself. I'm a certified senior advisor. I've been doing this since 1989, helping people with both Medicare and long-term care. And I absolutely love it. I'm passionate about helping people, whatever I can do. And back up for a minute, I know I helped so many Christian Scientists in the last 3 or 4 months. I probably talked to literally 800 of you across the United States. And you're the healthiest population I've ever dealt with. You're all kind and caring and very Christian-like, and it's a pleasure dealing with all of you. I just wanted you to know that. So if I say something that's not correct about Christian Scientists, hopefully Leslie will let me know. So the goal is just to help. So if I say something incorrect or anything, I don't mean to harm anybody or say anything incorrect. But a little more. I come from the Bay Area, from the San Jose Bay Area, and I have a very large Irish family. So I have numerous aunts and uncles and cousins, and I've helped so many of them. So when I talk about some stories today, which I like to share, because that kind of helps instead of just doing numbers and facts, I'm just going to use my family. That makes it the easiest. Then I don't offend anybody, and I have so many to share. It's amazing what can happen over going on 33 years helping folks with that. So again, our goal is to really help you mitigate healthcare costs in retirement. And Leslie's been great about helping me explain Medicare and why that's so important to have Medicare in place when you go into a religious non-healthcare institution like Ardenwood. So thank you for that. So we'll just keep rolling. Long-term care planning, I tell people, you're going to protect the most important asset, and that is your family, your loved ones. That's what it's all about. Not taking the steps to ensure that your family is going to be safe and that you're going to be okay. Just a quick agenda for today. We're going to talk about long-term care, who will need it. The biggest one is the consequences to your family. I found that's more important than anything. people don't realize the consequences to both your adult children, grandchildren, extended families. Talk a little more about Medicare, traditional long-term care policies, and we've got some new asset-based long-term care plans. So it's a different way to protect your family instead of giving all your money to an insurance company and never getting it back. It's a different way to plan for it. So let's see. Let's talk about a need for care. A need for care is created by really two types of impairments. The first one is a chronic health condition. And these are conditions that compromise individuals' abilities to get through most of life's daily routines. The second one is a cognitive impairment, whether it's a dementia, an Alzheimer's, something like that. So we're going to kind of go through what long-term care is. And Leslie, you jump in whenever you think it's appropriate, okay?
You know, I might jump in now before we start talking about long-term care, and that's to make a distinction between more acute care and chronic care. They're not always words that we use, but it's kind of how they're seen. So the difference would be for Christian Scientists, skilled Christian Science nursing care is a level of care that can be covered by Medicare Part A in several. We have, as I think John mentioned, we have 10 religious non-medical health care institutions, Christian Science facilities that provide this care through the Medicare program. And if you were also to have a Medicare supplemental plan, it will cover the deductibles, and it could also cover if there were a need for extended care. Skilled Christian Science nursing is defined by the need for assessment and oversight of a fully trained Christian Science nurse that might include care from the effects of a fall or a sudden need or difficulty with nourishment or a need for cleansing and bandaging, just a few things. There's two levels of care that long-term care insurance will cover, and that is what we call Christian Science care. So it's a lighter care that doesn't change from day to day, could be provided by a minimally trained Christian Science nurse or even a family member. This may include assistance with ADLs, activities of daily living, which Jim will talk about in a minute. Such assistance as transferring, mobility, toileting, feeding, personal care, more chronic in nature. And assisted living, it's another name for another form of long-term care that provides light assistance with personal care. At Ardenwood, we call this sheltered care, where Christian Science nurses provide assistance with ADLs and purposeful activities in a Christian Science environment. Ardenwood also has an independent living program for those that don't require any assistance. This is not covered by a long-term care insurance. And I'm going to stop there and let Jim continue with
Well, that's great, Leslie. Thank you. That's so valuable that you're on this call and helping with those too, because I would have blown that. So for sure. So remember, I'm used to dealing with a lot of non-Christian scientists. So having Leslie here is just invaluable to help me, to help you also. So we're going to talk about what is long-term care. And Leslie touched on the activities of daily living. It's kind of the way that they assess people when you're no longer working, right? If I was still working and I can no longer perform the substantial duties of my occupation, then I would be considered disabled and would be eligible for maybe some type of disability insurance if I had it, or whatever it is while I'm still working. But after my working years, they go, well, gee, how do we tell if you're, excuse me, if you're disabled? Well, there's actually they look at 6 areas, and Leslie went over them and I'm going to do them in the order when you get up. So normally when you get up in the morning, you transfer. Transfer is just a fancy word meaning I need some type of assistance to get out of my bed or a chair to get up, either somebody directly or standing by. In the long-term care world, that's kind of the same thing, means the same thing. Next is normally one goes to use the bathroom, and they call that toileting, whether it's assistance with whatever it is, including hygiene. The next one is bathing. Hopefully, that somebody after that, you're going to normally shower or bathe. And if you need some type of assistance, either getting into or out of a tub or a shower, then followed by dressing. Hopefully, you're going to go have some breakfast. That would be assistance with eating. And finally, maintaining control of your bladder and everything throughout the day, having control of that. The last one, so long-term care says, listen, if you can't do 2 of 6 of those activities and you have a long-term care policy, then you're eligible to, they call it to trigger the benefits, meaning you can start using the benefits on your policy. The other one is it's a cognitive impairment, whether we talk about dementia or Alzheimer's, anything like that. So if you can't do 2 of 6, or you have a severe cognitive impairment that's expected to last for more than 90 days, then you would be eligible to trigger the benefits on your policy to use for care. So next, I'm going to talk about circle of care and what happens when you don't have long-term care. And I'm going to use my mother-in-law's because that's what's happening right now. And both my wife and my sister-in-law are helping with her care. So that's what happens when you have a loved one, a mom, a dad, a spouse. That's who provides care first. And people do it. I see adult children. I did it for my parents. You do it out of, you love them, you care about them, and you're going to be the primary caregiver. That's just the way it is. My mother-in-law right now is having issues, several issues with, we just went over the ADL. She's having issues with those and memory. So right now, my wife and my sister-in-law provide her care. They do everything from helping her shop to bathe, to launder her sheets, shopping, paying bills, things like that, because out of love. I'm involved, and so is my brother-in-law up here. We're kind of the secondary caregiver, where on weekends, my brother-in-law is way handier than I am, so he can help build a fence, do things like that. He actually took out a bathtub and put in a shower to make it easier so my mother-in-law wouldn't trip, things like that. So right now, we're kind of the secondary caregivers, or we'll bring over some food or something like that too. The other ones that get involved when you don't have a plan of care is your community support. There's still friends of hers that pick her up and bring her to church, right? Things like that, or a neighbor will bring a meal by, things like that. So when you don't have a plan of care, all of a sudden it becomes about your circle of care, those who love you no matter what. They're doing they do it out of love to make sure that your needs are met. So I'm going to talk a little bit about long-term care and family because it's so important. I hope you may never need care, and I hope most of you on the call, I hope you never do. But the biggest thing is you're going to have to look at how is that going to impact your family? How does that affect them emotionally, physically, and financially? That's a big deal. I was telling you, I've got some older cousins down in the Bay Area, and I'm known in the family as, hey, I'm the Medicare long-term care guy, right? They call me with questions. I always want to make sure that everybody in my family is taken care of, or at least I've educated them and tried to help them understand all the pitfalls, right? With Medicare is not easy to figure out, and neither is long-term care. Or 2 of my older cousins I'd met with years ago, and they decided they were going to self-fund for long-term care, which is fine. At least they had a plan. I didn't think it was a great plan, but they own 3 properties down in the Bay Area and south of San Francisco, which means they're like multimillionaires, right? If you own 3 properties, all of a sudden you're a multimillionaire. Well, it turned out one of them needed to go into the Alzheimer's unit, and they chose a facility down in Willow Glen, California, right by San Jose. His cost was $15,000 a month, followed by his spouse, my second cousin, who later went in at $11,000 a month. That's $26,000 a month, over $300,000 a year they were paying. And just to show you what happens to adult children is there were 3 siblings, and one who was handling all the financial affairs calls me and says, you know, this is super expensive. Why didn't you do something and help mom and dad? And I go, well, I did. I met with them years ago, and their plan was simply to sell assets. They had assets to generate income. Well, unfortunately, when adult children are involved, sometimes one looks more at, is my inheritance we're spending than using mom and dad's money to help them. So without a plan in place, it creates animosity amongst adult siblings. I've seen it for years. I've seen it with my sister and myself. It's just part of life. And so a good structured plan takes care of that. I've seen the death of a parent bring siblings together, quite honestly, after all this happened. But caring for a parent just creates so much tension and anger amongst siblings because everybody has a different view on what I should be doing to take care of mom and dad, and should we be using their money or inheritance, unfortunately. So I'm going to talk next about the ripple effects of caregiving. And again, I see it right now, how that impacts your health as a caregiver. Again, some statistics here, 46% of reported that caregiving affected their health and well-being, and I can attest to that. I live up here outside of Sacramento, and I would go every weekend for 3 years down to San Jose, which is about 120, 130-mile drive one way. And I would take care of my parents. My parents were elderly. My father actually made it to 102, and my mom passed away at 89. It was pretty smooth until the last few years when they really needed care. And their idea of care was me providing the care a long distance, but that's okay. But you can only do it so long. Like what I see with my wife right now and my sister-in-law, it becomes very stressful, right? My wife goes, gee, I get depressed. I worry about my mom. And a lot of times that can, if you're in a relationship, it can cause a strain because you're always talking about my loved one and what do I need to do. And my wife was always so patient with me, understanding that I really wanted to take care of my mom and dad no matter what, and still try and, I love my wife and happily married 34 years, by the way. And I just wanted to make sure that, that she was taken care of also. So it does cost both emotionally, and I'm going to talk about financially next, because that's important too. With my mother-in-law right now, if she needs anything at the store or clothes or to go to the beautician, anything like that, my wife and my sister-in-law pay for it. Right? My mother-in-law spent all her money, and so that's kind of what happened. So we cover the cost sometimes for a cleaner to come in a couple times a month to help with more of the heavy-duty cleaning. And again, I talked about making modifications at the home. My brother-in-law's helped with that, and we do that out of our own pocket because why? We love my mother-in-law. I always tell my mother-in-law, you're my favorite mother-in-law. She's awesome, but we want to make sure that she's safe and she's in a good environment. And here's the other thing that's so important. Providing care to chronically ill people can make healthy caregivers chronically ill. I see that all the time. I've had clients down outside of Cupertino, California on a second marriage, and he was a big strapping guy, was a PG&E lineman, about 6'4", 220 pounds, big guy, nothing ever going to happen to him, right? Until at 75, he had a massive stroke. His wife, which is his second marriage, they said no one is ever going to put anybody in a home. So they were going to take care of each other no matter what. So they rearranged their front room. They kind of made it in. They brought in the hospital bed, and she took care of him around the clock. Well, unfortunately, it was so stressful for her that she had a bout with cancer, and it came back. And I see that all the time where the stress of trying to take care of a loved one by yourself makes really healthy people ill. We're going to talk now about some of the costs of care and why, in that example, she chose to stay home instead of going into a care center, quite honestly. And these are rates based in the San Francisco Bay Area, Northern Bay Area, from San Jose to San Francisco area. I'm sure many of you on the call, for example, if you're back in the East Coast, back in Boston, I know it's very expensive, or New York, maybe more costly, depending on where you are. But this is a pretty good example of California. So for home health care now, it's the average about $32 an hour. So you multiply that by, if you want somebody to come in for 4 or 8 hours a day, and it gets pretty expensive right away. Next, normally, the continuum of care happens when you need care and you stay home first. Nobody wants to leave their home. You want to stay home. Next, and maybe some type of community services, whether it's an adult daycare center where you can go for companionship, if your spouse is still working, and make sure that you're in a safe environment. Next step is normally a residential, and I'm talking about the non-Christian Science community. Normally it's some type of an assisted living or residential care where you start off and you may need some help with meals or bathing, things like that. And you can see the national cost there. It's about $6,100 a month. I'm in the Sacramento area and it's about $5,800. So it's pretty close. It's expensive. And you go, gee, that doesn't sound like a lot, but when you multiply it by 12 months, that's a big number. The last one is the average national cost, or at least in the Bay Area, for skilled nursing or custodial care in a skilled nursing facility. And that's a scary number. That's over $182,000. When I started doing this in 1989, back then they didn't call them, they called them nursing home policies. They weren't long-term care policies, they were nursing home. And that really scared people because nobody's going to end up in a nursing home, right? That's what I tell myself, and most of my clients say that's never going to happen to me. But I want you to know what's affected the cost over a period of time and what's going to continue to impact the cost.
Jim, before you move on to that, I think I'd like to insert kind of what the care rates are at Ardenwood, because we get asked that a lot. So it will depend on the level of care that's needed, and the rates are determined usually by the number of hours of care received each day. So skilled Christian Science nursing care, which is not the long-term care, but more skilled, can range from $585 up to $900 per day. This level of care can be fully covered by Medicare with Medicare supplemental insurance. So if you have those in place, it actually might cost you nothing to come. Christian Science Care, which is our non-skilled care, more long-term care type, ranges from $275 to $600 per day. And our sheltered care, which is like assisted living, ranges from $175 to $275 per day. Our visiting Christian Science nursing service throughout the Bay Area and our outpatient care are $60 an hour. And I know these numbers are scary. There also are other funding options that could be used in addition to, or in some cases in place of, insurance for help. And that is the National Fund for Christian Science Nursing is a very generous fund. It's administered through the Principal Foundation in Kansas City. It can help cover the cost of Christian Science nursing care, whether it's in your home or in a facility, and any level of care. It's a very simple application process. You can do it online or over the phone, and they're just wonderful to work with. And we've been very blessed, as have many individuals, by their generosity. The Principal Foundation can also assist with the cost of Christian Science practitioners. It's so important to be getting the care that we need and the support we need for healing. Some Christian Science associations and branch churches also have funding available for some of their members. Long-serving Christian Science practitioners and Christian Science nurses may be supported through some funds from the Mother Church. And many Christian Science facilities also have a benevolence fund. So there are options when there is a need. The most important thing is that you don't hesitate to ask for the care you need when you need it. Back to you, Jim.
That's so important, Leslie. You know, sometimes that really is. And I know I've talked to a lot of Christian Scientists over there in the past couple months. And it's so important that they understand how Medicare functions, how important it is to have, I think, both A and B. A lot of people ask about the types of insurance, and there's supplemental plans will help pay for care if they go in under Part A of Medicare, right, Leslie? It'll cover them
Right.
beyond the regular co-pays of Medicare. So it's so important to address that.
I want to just clarify, the Part A Medicare benefit is the one that works in a religious non-medical healthcare institution, which is how Medicare deems our Christian Science facilities. But so if you have Part A only, you can still be covered by Ardenwood. If you have Part B, it will also help. It will allow you to have a Medicare supplemental insurance, which will cover your deductibles, but it would also cover any other unexpected expenses such as if you needed to go for x-rays or made that decision, it can cover that fully.
That's exactly correct. No, that's a super important point. So, well, I'll go back and talk about how the trends affect long-term care, because it's of most of us on the call today, we're baby boomers. Did you know there's over 10,000, almost 11,000 people a day turning 65? And why does that matter? Because, well, I love this. By 2035, more people over age 65 than under 18, which is scary, right? An elderly population. So when you look at cost of care, and these are just more statistics, 85 million of us over 65 by 2050, fewer illnesses and more accidents, that's what we're going to see. But the reason the price is going up is simple. It's supply and demand. There's going to be more of us needing care. So the cost for home care services, assisted living, it's not going to go down. It's going to go up. It's simple supply and demand. Statistics, I'm not a huge fan of, because I quite honestly think you can look anywhere you can Google or anywhere on the internet, and you're going to see 500 different statistics about who's going to need care. Ultimately, they know through Genworth studies that 92% of couples are going to need some type of care. You know, I talked to you about my parents. You know, my father made 102, my mom 89, and they were really, really good, healthy, very Christian, caring people all of their lives, always did what helped others. But eventually, towards their end of life, they did need care. As much as they said they would never need it, they actually did. So I just want people to know that if you live long enough sometimes, and I know, Leslie, I believe in prayer and I understand the Christian scientists, but these are a lot of non-Christian scientists do realize it's something they could need care down the road. So just be prepared for it. You don't want to rely on the government programs, right? Because of the aging population. If there's more people needing care, we don't know what's going to happen to any of the government programs, if they're going to pay less or if they're even going to be there for some of us. So next, I'm going to talk about projected costs. I used what a current cost is in the Bay Area, and I only went out to 2030, because quite honestly, if I look at 2040 and 2050, those numbers are way too high and it scares people. So I just looked at some projected costs. For a male, the average time a male really needs care is about a little over 2 years. I put 2.2 years. So if they're in a facility now in the Bay Area, you're looking at $400,000, and in less than 9 years now, it's over $500,000. That's scary for most people. Quite honestly, some people go, well, that's just too big of a number to worry about. I'm not going to worry about it. I'm just going to deal with it as it comes. And believe it or not, females, you cost more. That's because in the non-Christian Science community, mortality rates, males die sooner than females. So females live longer and normally are going to require more care for non-Christian scientists. And you can see there, the average care is usually 3.5 to 4 years, somewhere in that period of time. And by the way, for females, that's why they charge you more for long-term care policies, because they know you're going to probably live longer and need care for a longer period of time. So next, Leslie, this will be good because we're going to talk more about long-term care and Medicare here. And you did a great job of explaining it. And if you'd like to, again, I think it's important people understand, right? The Medicare is there for skilled care, not for custodial type care. We know long-term care is about personal care and custodial care, and that Medicare does not cover that. I get so many calls from adult children, from clients on a weekly basis asking, hey, mom or dad has to go into this facility now. They need help with bathing, dressing, eating. And how do we pay for that? You go, how do I pay for that? And I said, well, you've got to write a check, right? You've got to pay for it. So they want to understand, well, how come that Medicare, Medicaid, Medi-Cal thing, they don't even know what it is. How come it's not paying for it? And it's because skill is the receiving now is not skilled care defined by Medicare. It's custodial type care, help with eating, bathing, dressing, excuse me, activities of daily living, things we're going to talk about in a minute here. So
the other thing about Medicare is it's not designed as a long-term care plan. So it is not intended to last for a long period of time. I mean, there's full coverage for 60 days, partial coverage for another 30 days. So if a need continues beyond that at the skilled level, that is why you would want to have a Medicare supplemental plan. But it's also possible you may come in, quickly be healed and go home and just use a few days of it. That's fine. But if someone's improving, we would take them off of Medicare. They're not necessarily getting those full 60 days as they progress. So.
Right. So next we're going to talk about what is long-term care insurance and what it covers. And I just want to make sure people understand it's not like traditional health insurance plans that you're on under age 65. Everything changes, unfortunately, as we age. It covers extended care services. So the new verbiage out there, instead of scaring people and saying long-term care services, the new lingo is extended care services. And that covers you for in a variety of settings for custodial type care, whether it's at home, community organizations, adult daycare, there's centers now out there for you. Assisted living, that's what the AL stands for. And finally, NH is nursing home. So we'll talk about some of the things you can use the monies for, right? If you have a policy, like my mother-in-law, if she had a policy, we could be using them for homemaker services. And that includes shopping, driving, transportation to go shopping or to a doctor's appointment, some cooking, laundry, housekeeping, which is important, and finally bill paying. So if you do have a long-term care plan, it is a big deal because you can have somebody come in and help with all these homemaker services and have it covered under your policy. That is a big deal.
Jim, I'd like to interject a little bit about care at home. There are definitely are times that it's the right thing. Absolutely, we all love our homes and want to stay there. But I think some questions you might want to consider, are these resources available in your community? If you're living in a more remote setting, they're not always readily available. There's not always Christian Science nursing available in every part of the country. Is the house a safe environment for the individual? Can they be safely living alone? Is the house in good repair? Are there too many stairs? Many things to consider. Is the individual isolated? If they're not getting out anymore, are they just alone at home? And is there someone nearby, a family member or close friend, that can provide some oversight and support to ensure that their needs are being met? It's difficult now with families living all apart around the country, to have a family member jet in once a year and then realize, oh my goodness, we maybe need to do something here. So as an alternative before care is needed, one might consider independent living program like the one at Ardenwood, where your housekeeping meals are provided. There's companionship with like-minded Christian Scientists. We frequently, our residents will say, wish I would have come sooner. They're really a very happy community, especially this last year. They have had such sweet camaraderie because they're not going out, they're not having visitors with family, but they're absolutely loving being here and having life go forward. But if there is a need for light assistance, and with some Christian Science nursing, our sheltered care program might be just the right idea, and that can be covered by long-term care insurance.
Well, those are great points, Leslie. I love hearing you talk about that. I was fortunate enough to visit Ardenwood. I don't know if any of you have out there. I did a presentation down there a while ago. It's an absolutely beautiful, caring, loving, serene community. It's just everyone down there is so gracious and caring. You're fortunate that you have a place like Ardenwood. So, but Leslie hit on a couple points that are super important. For people living alone, and if you need care and you do have a long-term care policy, you can use the benefits for home modifications. I see that all the time where people need to widen doorways if you're using a wheelchair. And I'm mainly talking probably more about non-Christian Scientists, but maybe pull out carpets, widen doorways, create ramps, grab bars and showers, things like that. Monies from policies can be used to provide that. But I want to talk about planning options now because this is what everyone has right now. If you haven't set up a plan, this is your plan. You're going to self-fund. Just like my cousins I told you about, that was their plan, self-funding. The problem is you can see their assets that with their homes, they had to sell a couple highly appreciated homes to use for their care. And that creates a cash flow crisis. I get those calls all the time from spouses saying, I don't know what to do. Where do I get the money? What do we do? What do we use? The second option, which is called Medi-Cal or Medicaid nationwide. California, we always have to be different, right? So we don't call it Medicaid, we have to call it Medi-Cal. That's when people almost have to impoverish themselves to take advantage of the benefits. And it just takes away all of your choices. And one of those choices is you probably can't use Medi-Cal at Ardenwood or in another Rinky. Is that correct, Leslie?
Right. At this point, none of the Christian Science facilities are participating in Medicaid anywhere in the US. So if you are looking to be dependent on that because of a very modest resources, it's not going to be an option for you to be receiving Christian Science care.
Okay. And the third thing to do is buy long-term care policies. And I don't think anybody today is going, gee, let me run out and buy some long-term care policies, because that sounds like a great idea. Resistance, everybody's just, it's hesitant, it's not going to happen to me. But I want people to know that there are different types of plans. We're going to look at the old ones and the new ones where you don't have to lose your money. It's not like your auto insurance or homeowners insurance where you're going to pay premiums for a long period of time and you may never even use the plans. Hopefully you don't, right? That's what insurance is for. But it's all about taking your monies and transferring the risk to an insurance company to ensure that your family is not going to have to take care of you. So there's a couple type of policies, the traditional type policies, which are the use it or lose it. You put money in, you pay a premium for a long period of time, and hopefully you never use it. Well, that's usually the number one objection. Why should I do that? It's not going to happen to me. I deal with a lot of folks that they don't understand that you can. It is tax deductible. IRS actually says you can deduct up to certain amounts depending if you're a business owner, or a lot depends on your tax situation. Traditionally, the policies are all reimbursement policies. You incur an expense, whether I'm staying at home and I have to incur an expense to have a home healthcare provider come in, and then the insurance company reimburses me and I pay the provider. Usually in the second or third month, they just start paying the provider directly because they understand that it's being used for what it was designed to be used for. My favorite kind of policy, actually, it's called an indemnity, and that's an insurance word, indemnity. It simply means it pays you a cash benefit. For example, Nationwide right now has an incredible plan that pays cash. So if I'm unable, if I have that policy, I'm unable to do 2 of the 6 activities of daily living, guess what? I can start receiving cash every month. So it's not reimbursement, they send me a check. So if I have a $6,000 or $8,000 or a $10,000 a month benefit, I get a check for that. I can then decide, or my spouse or my loved ones, how I'm going to use those monies to pay for care. If I want to pay my grandson to help maintain my lawn, if my daughter needs to go shopping for me, I have the money to choose to spend on it however I choose. There's no insurance carrier saying you must go through a licensed facility over here or a license. It gives you total flexibility. That's what I love about indemnity plans. And I think those are some of the best that work with Christian Scientists too, Leslie. So,
Jim, you've mentioned that you're working with a few, you've been an amazing advocate for Christian Scientists in the insurance world. I don't know if it's appropriate for you to mention the names of a few of the companies that you've worked with that
absolutely
have been very friendly toward us.
Yes, we're trying. We've been working for months behind the scenes trying to find insurance carriers that understand Christian Scientists. And I've explained so many times that this is not Scientology and Tom Cruise. Insurance companies don't get that. So I'm trying to be an advocate, and we've got a few insurance companies that are willing to work maybe better with Christian Scientists than others. For example, a lot of insurance companies, well, I'll just name the ones that were Lincoln National, for example, Nationwide, and these are all very strong, secure nationwide companies. We've also got Thrivent, which is a Christian organization, and also NGL Life, which is another company. And for example, some of these companies would normally require, gee, Leslie, I need to see 2 years of your medical records. Well, because you're such a healthy population and that you don't go see a doctor, they don't understand that. That actually scares them. Well, why aren't you going and seeing a doctor, and why aren't you on 3 or 4 types of medications? So after numerous talks, some of the carriers have said, listen, we understand that. In lieu of getting medical records, we would be good with just coming out and doing a face-to-face assessment and making sure that you can still, you can still move around, you can still ambulate, you can still do basic things, and you don't need the care right away. So that was my struggle trying to explain to insurance companies. But that's a good point. Those are ones that are willing to at least work with Christian Scientists. So.
Thank you.
And I'm excited because there's a new plan out there. It's new to most of you, but it's been around for a few years now, and it's called Asset-Based Long-Term Care. It's kind of interesting because it works through life insurance policies, and some are annuities, but most are life insurance. And it's simply, listen, if you take I just show an example for $100 and you put it deposit with the insurance company, pay a premium, you can actually turn that into a multiple. So if I put $100 in, I might get $300 or $400 for care, for long-term care right away. Well, realistically, you're not putting $100 in if you're putting in, I hate to use this number because it scares people, but it's easy to work with, $100,000, whether it's up front over a period of time, and you pay a premium to an insurance company, you're going to turn that $100,000 into either 2, 3, or 4 times that amount in benefit. So if I'm younger and I'm in my 50s, the multiplier may be 4. I may put $100,000 in and get $400,000 of long-term care benefit right away and still grow with inflation. Okay, that's important to understand. As I age, in my 60s, I may get 2.5, 3 times. It really depends on the insurance carrier and your age. It's so important though, because you can see over time, it grows. And the nice thing is, if you decide, listen, this isn't for me, I want to cash out, for example, Nationwide on theirs, you can get almost 100% of your money back. So if I do this for a few years and I put my money in, I go, that's not for me anymore, I want to cash out, I get my money back. Kind of a neat deal. And also, it's important because if you pass away and you haven't used it, instead of paying that $100,000 and saying, see ya, I'm never going to see it again, it comes back to your spouse or your beneficiary in the form of a tax-free death benefit. That's why it's on a life insurance policy. It's a tax-free death benefit to your heirs. If I had a $100,000, perhaps a death benefit may be $125,000, for example. And if I used $50,000, well, guess what? My beneficiary is probably going to get the $75,000. So they do get something back. Unlike I'm just going to tell you about my business partner who passed away a couple of years ago. In a traditional plan, and because we're in the industry, so we realized it was important 20 years ago to do that. But he had a massive heart attack, and he went to the hospital and passed away in 2 days. And his wife was like, well, thank God we paid into that long-term care for all those years, Jim. That was great to have, because it doesn't have that feature. But if he survived, he would have probably needed to use the policy. So now that's changed. That's kind of taken away that objection. Well, gee, if I never use it, I'm not going to get my money back. So just a brief recap, this is how it works. If you live and need care, at least you have it, right? You've got something. If you want to cash in, you're going to get most or all of your money back, depending on the insurance carrier. And most importantly, if you pass away and you never use it, well, your beneficiaries are going to get a tax-free death benefit back. So it's really important that you understand this. One of my sons who works in the office actually asked me, he goes, well, this is almost too good to be true. Why doesn't everybody get it, right? That's a common question I get. And it's because people don't have the health. It's important, or they don't have the assets to purchase it. This is showing what it requires when an insurance company looks at you. They look at all these factors. If you're married, they give you discounts. I've seen National Guarantee Life is willing to give us a 40% discount if you're married. Benefit amounts vary. Gender matters, right? Males are less expensive than females because you live longer than us. And your health. Health is really so important. When I get calls from clients that call me and say, Jim, I need to find out about long-term care. How much does it cost? Normally that means that they've just been to the doctor. Some non-Christian scientists have been to a physician and that they've been diagnosed. I get that all the time. I was diagnosed with Parkinson's, other things like that. And they want to know if they can purchase a long-term care plan. And the answer is no, they can't. Health really buys the plans. Without your health, you cannot get a policy. And the nice thing about these plans too, they're not all the same. It's not a cookie cutter where you can buy a $2,000, $4,000, $6,000 benefit. Everything is customized. There's so many clients. I don't think I have one client, or I have so many that have different plans, whether it's a smaller benefit amount they can afford. It's an asset-based plan. It's a traditional plan. There's some annuities out there now that have incredible long-term care riders on them. So everything has changed in the marketplace. So it's important for people to understand that you can still take action. This is some of the funding options. People always ask me, hey, how do I pay for this? I'm going to show them. I try to show them where they may have assets that they can use. But there's premium options. Some people want to pay at one time, right? One check can be done. You can do that. Other people like to pay over maybe a 10-year period of time. Insurance lingo says that's a 10 pay or 20 pay over 20 years. If you're young enough, you can have it paid up at 65. So these are just some options. So what we're trying to do is find something that's affordable for people that's actually going to help you as you age. Well, where do I find the money to pay for this? Leslie, I get that all the time. Well, income, it depends. Some people have a lot of monthly income when they retire. Savings, I see people that have money sitting in CDs and savings accounts paying 0 point nothing practically. And so sometimes we can transfer some of that over to a policy if it's appropriate and help them. Two other things that people have that they don't know they have that they can use for long-term care. If you have older life insurance policies that have been sitting around in your drawer, you can actually take them out and dust them off, and we can take a look at it. The government now allows you to do a tax-free exchange into the newer type of long-term care policies. So that's a big deal. I did a client who had, I forget what was $178,000 in a whole life policy. He goes, I don't really want this anymore. What should I do with it? And I said, why don't we take that and exchange it into a newer policy that has the new asset-based care that also has the long-term care benefits for it. And so that's what we did. It just happened to be we just used whatever assets he has and bought the appropriate amount for him. The annuities are another big deal. People have annuities sitting around too. I had actually a Christian Scientist send me one and say, listen, I have this, can I use it for care? And I said, well, we can take that annuity that you have and turn it into 2 or 3 times the amount for care. So if you had a $200,000 annuity, we could turn it into $400,000 or $600,000 for care if needed. Again, it's always got to make sure it's appropriate. It may be good for your neighbor, not for you, or good for your sister-in-law and not for you. But I just want people to understand there's money that you have that you can also use for that. The last one are 401k and IRAs. We know that age 72 now, the government requires you to take a required minimal distribution, meaning I've got to take money out of my plan or I'm going to be fined. A lot of people simply take it out of their left pocket and put it into their right pocket. So that's another area that we can find monies for people. So I'm going to recap on how long-term care impacts families because I've been talking a lot. I really like it when Leslie talks. She really brings up some great pertinent points. So, but this is, if you don't have a plan in place, normally the first line that's going to take care of is your family because they love and they care about you. Even if you don't want them to, they're going to do it. We're going to talk about care responsibilities are not shared equally. And what's that result in? Tensions among siblings. Caregivers' lives are disrupted. Their family lives are disrupted. And finally, it can tear families apart. And we don't want that to happen. Life's precious and it's short. And you don't want to spend your whole life taking care of your family to have something like this happen to you. So don't let this happen to you. I used to use the Titanic because I like sailing into retirement, but I see this all the time. Don't let this happen to you. You can turn unpredictable into predictable by looking at some type of long-term care protection. Or even Leslie said, you make sure you have your Medicare lined up and your supplemental. That's important too. But you do it by some type of long-term care protection. The reason it's easy is because I like that it's not a commercial, one call does it all, but it kind of does. If something happens to your loved one, you simply call the insurance company, start the claims process, where they're going to assign you not only a claims manager, but a case manager that's going to help you find professionals to help set up your care. There's no hassles for you. You can supervise the care instead of being a provider of the care. More importantly, there's no disruption to your cash flow. You can stay home, have care when you want it, where you want it. And this is a big one, even with people with a lot of money. It's so much easier to use insurance companies' money than your own. It really is. I've dealt with people that have millions and billions, and it's just so much easier. And you protect your retirement assets. So I'm going to wrap it up. I know we've got a Q&A we're doing after Leslie.
Actually, Jim, I've got one more bit of information that I think we both agree is very important, and that is to talk about advanced healthcare directives.
Oh,
I know John mentioned it early on, but I can't emphasize enough how important it is to have that in place. And it is simply a document, it should be part of your estate plan, a document that will authorize an individual to speak for you and help make decisions for you if you are ever unable to speak for yourself. So that could be, that individual could help make plans for you, sign documents for you if you needed to enter into a facility. And the important thing with that is, again, something we never think we're going to need, but it is such a protection. It is especially a protection for a Christian Scientist, and perhaps maybe family members are not Christian Scientists and might have some different ideas of care. So it's an opportunity for you to state in a legal document, when you have thought through what your choices of care are, who you want to speak for you that will honor your wishes. And this document, this Advanced Healthcare Directive, will be honored in any facility you enter, whether you find yourself in a hospital setting, not of your choosing. They will look at this document and contact this person that will help give directives as to what type of care you're willing to receive or not. It helps clarify with family members that may have differing opinions. It is your wishes that are being honored, and it's just such a protection. The question comes up often, when should it take effect? That is a question that is asked on the form. The easiest thing is to say now. Even though you don't anticipate someone doing it, you are appointing a person or a few individuals that you trust. So trust them to use their judgment to be in a position where they can act on your behalf when needed. If you are still able to act, you will still override what they may be saying. But if you're not able to act, it authorizes them to go forward. It's also important to know where the copy is. Each individual that is named as an agent should have a copy of it. You should have a copy in a safe place. If someone's living alone, maybe having a copy on your refrigerator door. I know that's a funny place, but that is where a first responder will look. If something were to happen, a neighbor called 911, they would come and they would look there to look for this document. You might scan it and have a copy on your smartphone. You might have a card in your wallet that says, I have an advanced healthcare directive, please contact this person to activate it. So there's just a lot of things that you can do that will really protect your choice of care in any situation that may come up. So,
wow, that's super important. Thank you, Leslie, super important. Well, I'm going to skip the common questions because we're going to do Q&A in a minute here. If you need help, what you need to know, you can call, you can email Katie or myself. Katie is in my office. She's been my partner 16 years. She's incredibly versed in both Medicare and long-term care, and we're here to help. So there's our contact information. Email is a great way to do it because sometimes after these, we do have a tendency to get quite a few people that want to ask questions. which and I love how, let me tell you, I love helping Christian Scientists. Again, you're the greatest people. It's a pleasure working with you, almost a privilege working with you. So I really enjoy it. But I think with that now, I think we're set up to take some questions and answers.
Well, thank you, Leslie and Jim. Let's now, in fact, go to your questions and answers. And I see that there are many that have come in. We appreciate this information. And I can't underscore enough Leslie's last point about the AHCD, or the Advanced Healthcare Directive. It is one of the most important things you can do, truly. Okay, the first question. It is a personal decision, and certainly family is important, but would long-term care for a person struggling with dementia be better at a Christian Science facility that isn't near a family versus a non-Christian Science facility where families see a member a couple of times a month? The member is getting no Christian Science input or surrounding, and though the family brings lessons and material, it isn't being read. I guess that'd be for you, Leslie.
Yeah, I'll jump in. Not every Christian Science facility is set up to meet that particular need. It all depends on how much care is needed by that individual. If it's an issue of shepherding and reminders, that's fine. If it may be that their care may be better served in a different setting. It just depends on the needs. It's difficult. We know there's many individuals that are presented with this claim of a mental imposition, and we long to support them. It doesn't always work within a typical Christian Science nursing facility setting. If there's a wandering or outburst, it can disrupt the harmony. So as far as that goes, it really is an individual choice for the family. Sometimes if it is the right program, an individual could do really well in a secure setting that is not a Christian Science facility. There are a number of facilities that do not require medication, but they simply provide a designed program in a safe setting. So to keep someone from wandering, that can provide 24-hour care. And there may be ways for Christian Scientists to visit occasionally and give that support.
Thank you. Number two, my brother is in a retirement facility and requires round-the-clock care 7 days a week. Is this covered by a long-term policy?
The answer is yes, it would be if he had purchased it prior to those events happening. The answer is yes, it would be.
Yes. When a student of Christian Science is in a Christian Science long-term care facility, we don't really call Christian Science facilities long-term care facilities, but we get the point. Is healing still expected, and does it often take place? Leslie.
I think it is always expected. Every individual is on their own journey. I've definitely seen progress. It does require the engagement of the patient, the practitioner, and the Christian Science nurse to keep that momentum going, and not accept it as routine care. Expect that Christian Science is healing every day. There is healing going on. It's a new case every day, and to go in that room and expect progress. It can happen, and I have seen healings.
Thank you. Number four, not knowing what long-term care means in relation to Christian Science and its followers, my question is, will it have any impact on healthcare proxies or power of attorney? Thank you.
Did you get that,
Not sure
Leslie?
I understand the question.
I don't understand that question either.
Not knowing what long-term care means to Christian Science, my question is, will it have any impact on healthcare proxies or a power of attorney for healthcare?
I think when you have a power of attorney for healthcare, I mean, they are helping to make the decisions. So if it's at a point that the individual is not able to make their own decisions, then it would be the agent listed on that document. So especially if there's diminished mental capacity, it would be very helpful to have that in place. Many facilities will require you to have that in place.
Next one. How does memory care need fit, a memory care need fit with long-term care
Let
insurance?
Jim take that one.
Are you
from-
talking about in a, for example, at Ardenwood?
Well, I think I would like to have the answer for, does long-term care insurance cover in like a memory care facility?
Absolutely, it does, right. Any type of dementia, Alzheimer's, absolutely. You can use the benefit for that. If it's a licensed facility, for example, non-scientist facility, they're licensed, absolutely. That's the most important thing. You're using the insurance company's money to take care of your loved one. Absolutely, it does.
And it's based on the ADLs, but sometimes if there's memory challenges, that can impact someone's ability to function with their regular ADLs. So
right, that would do it. Like in the insurance world, the cognitive impairment would do it right away, regardless of the other 6 activities of daily living. If you have a severe cognitive impairment, advanced dementia or Alzheimer's, it's expected to last for more than 90 days. The policy would start paying the benefits automatically. So, that's the benefit of having one.
right. John, you're muted.
Thank you. A 40-year-old Christian Science nurse needs help. If staying at Ardenwood, where she trained or he or she trained from 67 to 68, can a non-Christian Science spouse of 51 years stay in a room with her?
We're obviously expecting healing. We certainly allow visitors to come, but we would not allow a spouse that was not a practicing Christian Scientist to actually be living at Ardenwood. So, and John, maybe you can add to that. We have certainly had individuals stay in the room visiting, but not move in. Am I answering the question?
It really gets down to love, isn't it? And this is why these topics are so intimate, and this conversation is so important, because it's about people's lives and truly 2 people that love each other over 51 years. I guess it would depend, sometimes probably not, maybe not stay in the room with her, but we do have, we've had residents that the spouse was not necessarily that much of a Christian Scientist, but they honored everything about Christian Science and followed our protocols here, if that's the right term. But probably would not be able to stay in the room with the patient per se. But we'd have to explore that. I mean, we're always trying to see how we can help the family rather than, to say no. So that's the way I would answer the question.
Every case is individual. So
every case is individual.
Call us.
Yep, please call. Next question. Are you familiar with GEHA insurance, which covers Christian Science nursing homes? Jim? Or Rogers?
Are they talking about General Electric, Genworth, perhaps?
I'm not sure. It just says 4 letters, GEHA.
You recognize that, Rogers? Have you heard of that, Rogers? GEHA?
I heard. I think it's the one. It's a government employee program.
Okay.
Government employee health.
And I've never seen it actually in use here. I don't have any personal experience with trying to administer the insurance, but I believe it's a government employee insurance program.
Didn't the question mention Christian Science? So maybe there is a rider.
That's what it says.
There's a rider.
It infers that. Are you familiar with GEHA insurance, which covers Christian Science nursing homes? I'd like to learn more about it. I'm not familiar with it.
No.
We'll have to learn more. Good
It's
question.
in writing, then you can hold them to it.
And Jim, just explain what a rider is, please.
A rider is an enhancement to a policy. So if you have a base policy and they put a rider on there, for example, a Christian Science rider or a rider that's going to cover something else, it's an enhancement that usually they cost more. It's another feature that they build into that policy for you. So a lot of times you have the option of adding these riders on or not. So that's what a rider is.
So it's basically like an amendment that's enforceable.
An enhancement, that's right. But Leslie's right. People are always asking me, hey, does my policy pay for this or that? It's in your policy. I actually read those pretty much on a daily, and they're very difficult. The verbiage, you know, you can give to an attorney and they can, well, I interpret it this way, but it's pretty clear cut in there what your coverage is. So, but if they talk about an alternate care benefit, for example, that can be used for Christian Scientists, then you have to kind of go down that rabbit hole and find out, is that something that I can use, Rogers, for example, if I go to Ardenwood? So there's all kinds of riders or enhancements that you need to look and see if you have it on your policy or if you've paid extra for it.
There are policies that have a specific Christian Science rider that I've seen where they will actually state a nurse. What would the term nurse can also be used to describe a Christian Science nurse, not just an RN.
Right.
A term physician.
Licensed health,
when we're looking for, yes, yeah. So, you know, that's a rider that I've seen come across where they give specific terms and how it equates to Christian Science
Right.
facilities.
And Rogers, if somebody had an indemnity plan, that's why I like those. If they just had cash, have you seen those? Are those beneficial down at Ardenwood where people came in and said, I've got cash from my policy? I would think that would work better than a reimbursement type policy.
Yes, we've seen those where they come in and typically the ones I'm thinking of have some type of a trigger mechanism in the policy. When that triggers, then the payment starts to come in at some type of guaranteed amount as opposed to an invoiced amount.
Right. That's exactly right. They get that benefit no matter what. If it's $6,000 or $8,000 a month, I get that money, and then I can pay Ardenwood, or I can take my wife. She can take a trip to Hawaii. She can do whatever she wants. But that's why
Exactly.
I think those indemnity policies are so beneficial. I really do. I think that's a big deal to scientists.
And one thing I was just thinking as you're both talking, and it points to this question, know your policy, read the policy. I know that sometimes, I know, Rogers, we will be asked here at Ardenwood, and you get this probably all the time, Jim, I bought this policy, I don't really know what's in it. So you really have to have someone either interpret it or have someone really, or yourself, read it through in detail because it's in the fine print, isn't it?
Right. That's a great
Everything's
point,
in the policy.
It is. I've had a scientist send me some of their policies from they purchased back in the late 90s, and they did have a Christian Science rider. And he asked me to explain it to him. I said, well, listen, normally you can call the insurance company 800 number or your agent or broker who sold you that. I'm happy to kind of give you an overview, but I can't sit there and, you know, spend an hour on your policy. But you're right, Rogers, it's in the policy. Read the contract. But again, the verbiage is so, it's so confusing sometimes about special riders or enhancements that they can use. And so often those can be used to pay for your facility. So.
Great. Next
Yeah,
question, I guess
along that line, I think an important thing is when you do want to come to Ardenwood, have the policy with you as part of your packet so that we can review. You know, I do get people asking me, well, do you think this will pay? I have no idea. You know, it's what's in the policy. So bring the policy, let us read the policy, and at least have an educated idea as to what it might cover.
And if you don't know where your parents' policies are, you might ask them.
Yes.
Yes.
That's critical, like the Advanced Healthcare
Usually in a
Directive and
shoebox.
policies.
Know where they are and take
on top of the closet. But you know, since we're talking about that, there's a feature on most all of these traditional policies that I want to bring up. It's called waiver of premium. And I see so many people, you have this waiver of premium means once you start receiving the benefits for a period of time, they waive the premium. You no longer pay the premium that's built into most all traditional policies. And I see so many people when I visit with Medicare that are in their 80s and when they have long-term care and one spouse obviously had a stroke and they need help with light house cooking, cleaning, well, they can qualify, they can trigger the benefits to use for that policy. Well, why would they want to do that? Even if they just use a little of the benefit, John, you know what happens? They quit paying the premium on that policy. So you really do have to know your policy. So everybody that's watching, if you have a policy, take it out and look in there for waiver of premium. When you use the benefit, you normally quit paying the premium.
Great point.
Good to know.
We're now at 5:30. Since we had some technical hiccups, perhaps we could go another 15 minutes. Is that fair? I don't know. I guess it really
Sure.
depends upon how long people want to stay. And once again, we will have another Q&A session a week from today at 4 p.m. till 4 to 5:30, or as long as we get the questions. So Amy just said we've got a lot of questions here. Next question, please. Can someone rent an apartment at Ardenwood for 1 month? The answer is yes. Number 13, are Christian Science care facilities covered? Oh, here we go. Christian Science care facilities covered under GE, now Genworth incorporated policies. Maybe that's,
The answer is gonna be in
GEHA
your
before.
policy. Yeah, it's in your, the answer's in the policy. They just have to look at the provisions of the policy and see if it's covered. And it's very difficult because that's a specific policy, right, to answer that question. So like John, you said, you have to look at the policy. There might be an alternate care benefit that can be used, right? That's not traditional, that can be used in a Christian Science facility. It depends. So for that individual, you would want to call Genworth, right? The Genworth and GE, it's all the same. That you start off as Fireman's Funds to Amex to Genworth to GE. It's the same lineage. All you have to do is call. You can call our customer service number and ask them and say, how does that benefit work? That's what they want to know. You bought the policy, so you need to, what you want to understand how it functions.
Exactly. How about long-term care insurance for people who do not have family?
Who's going to take care of you?
Sounds like a good plan.
I get a lot of, for non-scientists, I've dealt with a lot of single males or females, and they're like, I don't have anybody to take care of me. Who's going to take care of me? And I say, that's why you can turn to an insurance company. And like, I know that sounded, I didn't want to sound hokey. One call does it all. Call the 800 number. Sounds like a commercial, but it's the honest truth. If you have that policy, you simply call, they open the claim, and you get a case manager that's going to help take care of you, provide your care, tell you where to go, what you can use your monies for, things like that. So if you're single, I think that makes more sense, quite honestly, to have a policy.
And also, from what you said, it protects your assets. If you would like to spend the insurance company's money rather than your own, so that you can give money to friends or family or Ardenwood or your
favorite, I was going to
church
say,
or
501c3 charity, John, like Ardenwood.
exactly.
Yes.
So it really is good planning. Is Jim's work California centric, or can he help Christian Scientists in all states?
The answer is depending on which state. So I do a lot of long-term care. I'm licensed in 12 or 15 other states too. It just depends. Getting licensed in another state is simply paying a fee to the state. For example, I had to add Georgia last week. Very simple. Now I have a non-resident license in Georgia as well as several other states. So I try and help as many people as I can. And if I can't, I'll let you know.
Great. Here's a good question. Who determines if you can't function in two of those categories of ADLs that you mentioned earlier, Jim and Leslie?
A licensed healthcare professional, that's what's normally built into the contract. But a licensed healthcare professional has many meanings depending on the insurance company. So without getting too technical, they have all these social security codes that say, what is a licensed healthcare practitioner? It can be anywhere from a licensed nurse to a geriatric psychiatrist to an MD to a doctor of osteopathy and everywhere in between. a lot of times, like I was talking to one of the insurance carriers today in particular about Christian Scientists and what do we do if somebody's there. Thrivent was very good about saying, listen, we'll provide. We would send somebody out to help assess them, a couple of the insurance companies. So you just have to know that if that did happen, that they would be willing to send out, for example, a licensed, a different type of nurse to come out and assess them and help you qualify for the benefits. One of the pluses, I'm not doing advertisements for insurance carriers, but some of these fraternal companies, like, for example, Thrivent, they're excellent. They look for ways to pay claims. They don't report to shareholders. They're a fraternal organization that's interested in helping Christians. So as a matter of fact, to have a policy with, Thrivent, for example, you have to be a Christian. But they go out of their way to help fellow Christians on claims by doing that service.
I just wanted to add that I have actually filled in some of these forms, not as a physician, but and stating Christian Science nurse. And I know it depends. Some are accepted, some may not be, but it doesn't always require a medical personnel.
And here's a good follow-on question. Do the asset-based long-term care plans require a medical exam to qualify?
That's a great question, because the answer, it depends. So the companies I've been talking to, trying to narrow it down to help specifically Christian Scientists, one of them would require an exam. The other simply says, since you don't have any medical history, excuse me. So for example, not to single John out, but if they said, John, I want to see your medical records for the last 2 years, and you go, well, I don't have a physician. I don't see a medical doctor. They're willing to come out and do a face-to-face assessment and say, we're willing to waive that requirement where we must see medical records. You see, the rest of the population that's non-scientists, they're not as healthy as you. They go to the doctor, they're taking all kinds of medications. That's what insurance companies are used to seeing, right? They understand that. So what scientists are going, well, how do I get somebody's medical records if they haven't been to a doctor in 30 years? So some of the companies said, listen, we're willing to come out and do a face-to-face assessment, ask you the health questions. Leslie, for example, they want to make sure that you can transfer and ambulate, get out of bed, walk around, that you're mobile and you don't have an impairment already. So we're trying to find companies that are more Christian Science friendly. So it's not easy out there.
Really appreciate what you've done, Jim. You've been amazing.
Mm-hmm.
It's just not easy, right, Rogers? You have to fight them. So
Yes, exactly.
Yes.
Here's another great follow-on question. Can you purchase a long-term care policy after you turn 65?
Yes, preferably before. It's cheaper when you're 64 than when you're 65, and it's cheaper when you're 65 than 66. So the best time to buy a policy is yesterday. So it's always based on age. The younger, the better. So even 64 is priced less than a 65-year-old. But some of the policies will actually go up to age 80, and they have different types of annuity products now that can go up to, I think, also age 75 or 80. So somebody has a $200,000 annuity, we can transfer it over and perhaps turn it into a $400,000 benefit for long-term care. They still have control of the asset, but that way they could use the monies for care. So there's different options out there. We just have, that's right, no cookie cutter plans. You have to just look and see what's best for Rogers may differ from what's best for Leslie and for John. Everybody's different.
To purchase a long-term care policy, does an individual who is 65 years of age need to participate in Medicare Part A and B?
No. No. Because remember, you can buy it as some of them as early as age 30 or 40. So Medicare is not required for long-term care.
But it is required for Medicare supplemental, which
Yes.
you might also want to have.
When you're 65, absolutely,
Yes.
yes. Right.
You've already answered this one, Jim. Is there an upper end age limit for purchasing long-term care policy? I think you just said 85. Is that correct?
Yeah, it depends, sometimes 80, sometimes 85. But I will say this, because of the COVID situation out there, a lot of the insurance company lowered their ages from, like, for example, from 80 down to 69 until the virus is under control. And I'm starting to see them loosening up a little bit and aging up to 75 again. But they didn't want to insure anybody over 69 or 70 for during the COVID-19.
I think this one you've already answered, but it says, if you've already been diagnosed with the claim of dementia, can you start a long-term care policy?
No.
Um,
It's like, John, I don't mean to just say no, be callous. It's like saying, well, my house is on fire. Let me call my State Farm guy right now. I need to up my policy limits. They're going to say, no, I'm sorry, your house is on fire. You should have bought more insurance prior to that. So that's
Right.
a pretty comparable example.
Great example. Leslie, is there a Christian Science facility who takes cognitive cases? In other words, if a person isn't thinking clearly and can't remember how to pay their bills, etc.?
I think that's a fairly mild situation. I would say many facilities could be able to take in that individual. It would be important that there be an advanced healthcare directive and someone able to make decisions to help them with that. It's all possible. It all depends on occupancy availability as well in the facility.
Right. If you do not have Medicare, I think you already answered this as well. Can you buy a long-term care insurance policy?
Yes.
Yep.
What is
Right.
the cost for sheltered care at Ardenwood, Leslie and Rogers?
I can go over that again. It starts at $175 a day and goes to $275 a day. And it's based on how much care they're needing during. So there's 3 different levels.
Thank you.
Mhm.
Do you have to have a physical, or how, and you kind of answered this, but there are nuances here.
Right.
Do you have to have a physical, or how thorough a physical do you have to get?
That's a great question. I was arguing with one insurance company, telling them why Christian Scientists are such a great risk, right? Healthy, no medications, most of them have excellent height and weight. And they came back and said, because there's no medical records, one of the companies would require a paramedic exam. Paramedic exam would consist of coming out, probably asking your height and weight, maybe asking a few basic health questions, seeing that you're able to move around. But one of them did want a blood and a urine sample to look for example, like triglycerides, cholesterol, and believe it or not, a drug screen sometimes. So one of them would require that, and that would be up to individuals if they're comfortable with that. If not, we just simply look at another company if that's what they want.
Thank you. You've kind of said this. So just to clarify what you said earlier, obtaining, at least during COVID or whatever, maybe just clarify this again. So just to clarify, obtaining a long-term care plan is not available after the age of 80 or over the age of 80?
The answer is it depends. There's some carriers now that will take that business. There's other options, for example, on the annuity side that may be more beneficial, but still gives you some extra dollars to use for care. So we'd have to look, that's on a case-by-case basis. So I hate to say yes or no to those because you never know. Tomorrow an insurance carrier could say, sure, we're raising our limits to age 85. So.
And I guess this further question on this, please elaborate on some policies go up to 80 years of age. Do you mean you can't take out a new policy afterwards, or that the policy stops at 80, even for people who had the policy beforehand?
No. So most of the policies are contractually guaranteed. Once you start paying on them, they can't just cancel them. So no, that's the answer is you can keep it. You can't purchase one normally after a certain age. So if you have one, you're fine. If you're 80, you're thinking about it, we can talk about it, but it really depends.
Here's back to Medicare a little bit here. If I don't have a Medicare supplemental insurance plan, or as part of my plan, why should I have it?
Well, you want to talk about the co-pays, Rogers, for example, if somebody comes in, they have to pay the Part A deductible, and then after 60 days, the cost per day.
Sure, under Medicare right now, this year, our deductible is $1,484, I think it is. That's when you walk in the door, that's what Medicare requires of you. For that, they will cover you for the first from day 1 through day 60. If you're still needing skilled care, Medicare level care at day 61, then they are assessing a per day copay. And this year, I'm not sure the exact rate, it's 374 or something like that.
Right,
It went up
371,
just
right.
371. So that's per day. If you stay all 30 days of that time, it does get up into, a $10,000 bill for that 30-day period.
Right.
And so that's what a supplemental can help you with.
And,
Right.
and it can go beyond the 90 days as well if there's still a skilled care need.
Right.
There's also not a
Correct.
guarantee that you have 60 days of coverage because we are expecting healing. So if you come in, make great progress, we could decide in 2 or 3 weeks that, you know what, we can't keep you at that level anymore. That's the good news because we're seeing great progress in healing. It is required that the individual requires skilled care. So.
And that's the advantage of having a supplemental plan. You also have to have Part B, but the supplemental, Rogers, will pay, I've seen them pay for at least a year, right?
Yes.
If they're, so you don't have to worry about that 371 or the 7, whatever it is, 42 a day for the reserve days. That supplemental plan would take care of all that. So I think, Leslie,
Right.
like we're talking about, I think that's so important for scientists to understand that protects them, right? If they have some type of supplemental plan.
Yeah. It also covers if there's a need for, maybe there's a fall and someone chooses to go out for x-rays, have a bone set, hugely expensive. So
Hugely.
having A and B to cover that, we're talking tens of thousands of dollars, even for x-rays, and even if they don't do very much. So it's just a good insurance to have.
Yes, I think that's what we talked about before. People have no idea how costly care is.
Isn't it scary, John, how expensive it is? I mean, I see that all the time. I've seen outpatient, right, for 8 hours, all of a sudden billed at $64,000. It's astonishing how expensive it is. Or to get an MRI or a CAT scan, Rogers, down at UCSF or somewhere, it's unbelievably how expensive it is. So, Leslie,
so we have it easy.
I think it makes really good sense for most people. I would want to make sure that I've got my Part A and B and probably some type of supplemental coverage at a very nominal cost. So you don't have to worry about that if that does happen. You want to make sure you have that basis covered before you kind of look at least I would look at it before long-term care. You want to have that covered, I would think.
I would say we probably use a Medicare supplemental policy more often than we use a long-term care policy. Does that sound right, Rogers?
Yeah, I'd say that's true. But
And Medicare. And then if you have the Medicare supplemental, it's just can be very helpful as well.
Right.
And like we said at the beginning, it's all about how you work with your family in terms of your choice of care and what they're looking for as well. How about do one more question? We've come to 5:47 p.m. One more question, and then we'll close. And then we've got a lot of questions for next week already. We've got over 30 questions for next Thursday. But here is a really good planner. Should we recommend to our 30-something-year-old children that they purchase a long-term care insurance plan now?
Wow. That's a personal decision. That's pretty young. I have 3 adult boys, 30, 32, 30, and 27. They don't have it yet. If they were going to do that, my one son has a life insurance policy that's got a long-term care rider built into it. It just does. And I think that would be the way to go, where you build up cash, you have your money in there. But to simply buy a long-term care policy, boy, that's pretty young, Rogers, don't you think?
I would say so, yes.
I think it would be hard to convince them to spend their money on it at this point.
Yeah.
For
Yeah,
sure.
there would be, I think, and that's that time of life, there's probably more
Oh,
pressing
different
issues.
priorities, yeah.
Yeah.
Yes, for sure.
Well, Leslie, thank you. Jim, thank you. Rogers, thank you for guiding us through the ins and outs of long-term care insurance options for Christian Science. Jim is the best qualified to answer questions on this subject, and Ardenwood and the Christian Science Provider Network can serve as an ongoing resource. So please don't hesitate to call with any questions at any time. We stand ready to help. And thank you all once again for joining us today. We will return next week at the same time for more of your questions. We will probably most likely be re-recording this segment tonight with the technical issues, so that when people watch it, rebroadcast of this, they'll get what we were hoping to get from the beginning. But join us next week and save some of your questions. And also, please save the date for Sunday, May 2nd at 2 p.m. Pacific for our online annual meeting featuring inspirational speaker Madeline Maupin. And please check our website soon to register. And once again, to register for next week for the Q&A session that will continue this particular program. So goodbye for now. Thank you all, and we'll hopefully see you soon again.
Okay.
Thank you.
Bye-bye.
Bye-bye.